Welcome to Kasaragod Meditrack program. In this session today we are going to discuss about unwanted facial hairs. In this discussion we have a dermatologist and a gynecologist, Dr.Sruthy A.G, gynecologist and fertility specialist, and Dr.Faizan Kalekhan, dermatologist. Welcome both. Okay. See ma'am, in the introduction I have already mentioned that unwanted facial hairs. See, especially this problem is facing by women. See, why it happened, why it is coming to the, especially for women.
Okay, see, unwanted facial hair, when you tell it, it is actually unwanted. Means normally a female should not have any facial hair. That's the norm.
Okay.
And hormone basis also, a female body is not allowed in their normal female hormones that a facial hair is growing. So in that way, that is something which is a concern, especially more so a cosmetic concern, to be frank.
Okay.
But the thing is, patients, we should be aware that when they come to us, we should, they should know that it is not only the cosmetic concern, but it is the...
Excuse me, see, being a patient, how they know that whether it is treated by gynecologist or dermatologist, how they are selecting the doctors?
Yeah, correct. See, direct with only facial hair, they don't come to a gynecologist per se. Nowadays, few people are coming, being a female doctor as such, but most of them, they actually visit a dermatologist.
Okay.
So this is what they actually start up with.
Yeah, the dermatologist has a prominent role for treating this unwanted facial hair. Yeah, let's see, sir. Okay, continue.
Basically, whenever a patient comes to us with unwanted hair growth, so normally there is something called as vellus hair which is present on the face.
Okay.
And because of certain internal condition, so because of this, there is stimulation of this vellus hair, and then there will be thickening of hair.
Okay.
So this thickening of hair, first of all, whenever a patient comes to us, we have to evaluate why it is happening.
Okay.
So unless and until we don't evaluate why it is happening, then we'll be treating only the existing condition, and again it is going to keep happening once again.
Okay. See, sir, during that evaluation process, naturally, what you can see there?
So during evaluation process, when we notice the cause of hair growth, unwanted hair growth, whenever we are evaluating the process, we understand that there is underlying hormonal imbalance, and this hormonal imbalance may be one of the main reasons because of which
this kind of hormonal imbalance, which category, which age group you can notice?
It can initiate right from the starting of the first menstrual cycle, 13 to 14 years onwards, and it can go until even during menopausal age, that is 40 to 45 years old also.
Okay.
So whenever this situation arises, so we have to deal with it. So some people come with isolated symptoms of unwanted hair growth. Some others come with other multitude of symptoms with other than unwanted hair growth. And whenever these symptoms we look into in the patient, and we evaluate the patient based on clinical examination or based on some certain blood test, and then we come to a conclusion, okay, this is a problem. And whenever we notice that underlying hormonal issue is to an extent where it has to be addressed, that is when we need help from a gynecologist. And when internally a gynecologist starts their treatment and externally we tackle the unwanted hair growth, that is when a particular patient will get more benefit with the treatment.
Okay, ma'am. Then what is the role of gynecologist here?
So that's what, when the patient comes to us directly or a referred patient from a dermatologist, we actually find out the cause. It might be genetic or hormonal imbalance, as sir told.
Okay.
So if it is genetic, it goes in that way, and if it's an hormonal imbalance, which we are more commonly seeing now actually, PCOS, the term PCOS is very common these days, because that's a quite common reason what this facial hair comes into picture.
Okay.
It's not only facial hair, they will actually have body hair growth in a little more, a little more than compared to a normal female. So it is basically in PCOS what we see is the male hormones which is a little higher. So that's the imbalance between the hormones there. Our female hormones will be a little reduced, and the male hormones, that's testosterone, those androgen levels will be increased. That's the reason they have all these male kind of things, like facial hair, scalp hair loss becomes, as you told, there will be other symptoms also, like scalp hair loss will be there, facial hair growth will be there, lot of multiple pimples will be there.
Yeah.
That is also a concern of this younger age group female.
Okay.
As sir told, that it is there even in the mid age to an older age group also. And they'll have other features of PCOS, definitely, period irregularity. That's how we come to a diagnosis that it is not only facial hair growth and there are other things also. And few hormonal tests is what we do. And then we curate a treatment to such patients.
Okay, regarding the treatment side, okay, see, after the evaluation, is it a combined treatment? That means both gynecologist and the dermatologist combined treatment, or separately? How they are
No,
make the
definitely
treatment?
what we will tell is, since there are two different concerns, hormonal changes are there, that's why these symptoms are coming
If the hormonal changes are there, such a situation?
That also in genetic level also. See, genetic means the cause might be genetic. PCOS, the cause is a hormonal imbalance which needs to be genetic. Also is a hormonal imbalance itself. But a different type of hormones than PCOS. But basically both are hormonal changes only. Okay, so these changes required hormonal balance also and the superficial cosmetic treatment also. See, hormones will always get your hormones to balance. So as hormones are in a regular way, so your new follicles are not developing. Basically in PCOS what happens is male hormones are increasing and there is something called insulin resistance. Because of that also lot of these changes happen. When the glucose metabolism is not happening properly. So that level of treatment is what we tackle as a gynecologist, because that's the cause which is happening there. So that we tackle, and combined to that we do the cosmetic treatments also all together, because see, once you're doing only cosmetic, imagine you're doing only cosmetic treatment, there whatever abnormalities there you're treating, which sir will be explaining to you. So other than that the cause is not treated. So again she is going to get those things, symptoms, whatever it is, facial hair growth, acne, hair loss, again it is going to repeat. That's only symptomatic treatment. But the base treatment, the cause of it needs to be treated. So that's when we come.
What are the cosmetic treatment? What are the procedures?
So mainly for unwanted hair growth, the line of treatment is laser hair reduction, and the topical treatment, the creams, all those things will not work to any extent. So whenever we consider a hair, so hair has something which is called as a hair follicle, which is inside the skin, and hair shaft, which is extending outside the skin. So as madam rightly told, so if at all we are treating anything superficially with some laser procedure from outside, the follicle keeps regenerating again and again because of the internal changes, that is the increase in hormone levels. So whenever we do it in a combined fashion, so we are destroying the hair follicle which is inside from outside with laser, as well as we are making sure that it does not have a capacity to regrow by giving certain systemic treatment like tablets, so that the hormone levels come down. So when we do it in combination, it works well. So coming to the laser hair reduction point, the very important aspect everyone has to understand here is, it is called as laser hair reduction and it is not called as laser hair removal. Because we cannot remove the hair completely from that position. We can regress or reduce the size of the follicle by damaging the follicle with laser, and each time we are damaging the follicle, the chance of follicle to regrow is reduced. So that is why it is called as laser hair reduction.
For laser hair, how much sessions needed?
So generally, for this to understand this, we have to understand the hair cycle basically. So generally, one hair requires somewhere about 3 weeks to 4 weeks for it to develop from below to above, like from the root level to the hair shaft level, which is protruding outside. So generally, we are not born with one single hair throughout the life. If that was so, then we would have such a long hair. So every time the hair cycle changes, it has a growth phase, it has a resting phase, it has a shedding phase. So once it reaches the shedding phase, simultaneously a new hair comes from below, that is a growth phase. So each time whenever the hair is in the growth phase, that is when the follicle will be very much active, and that is when we have to hit with laser. So at that time, in a given situation, somewhere about 5 to 10% of the hair follicles will be in growth phase.
Okay.
So now considering this, imagine whenever a person, we are doing a laser hair reduction process, the first session. So we are targeting only 5 to 10% of the hair which is in the growth phase.
Okay.
So cumulatively when we add, so 5 to 10%, imagine 5%, so 6 to 8 times when we consider, so somewhere about 60 to 80% result we'll get. So considering 10% as well.
Okay.
So whenever we give 6 to 8 sessions, somewhere about 60 to 80% of the hair follicles we have targeted.
Okay.
So when we target this much, there will be significant amount of thinning of hair and reduction in the follicle size.
Okay.
And the hair will not have enough strength to come out.
Okay.
So that is why the number of session will go higher.
Okay.
In case, imagine in a person who has underlying hormonal difference, so each time we are targeting 10% hair,
Okay.
and we damage 10% hair.
Okay.
By the time next session arises, the internal hormones will influence that follicle and regrow that follicle another 5%. So effectively we have damaged only 5%. So the number of session increases.
Okay.
So this is the point when we notice, even when we do not take help of a gynecologist and start the procedure, we tend to notice that we are doing continuously certain sessions and the patient's hair is again growing thicker. So that is when we understand that okay, the hormone influence is too high, even though if it has not come out in the blood tests, it's still going on influencing the hair follicle. That is when we need an in-depth solution for this particular patient, and that is when we refer to gynecologists and we need their help.
Okay. Sir, Sudhi ma'am, any pre-test for before the procedure?
In particular for laser hair reduction, there's no pre-test like that.
Okay.
But to find out the cause, definitely yes. That's when we detect that hormonal balance or imbalance, whatever it's there.
Okay.
So based on that, we will start the treatment then and there, depending on the imbalance what we find out.
Okay.
Like if it's PCOS, thyroid abnormalities, prolactin levels are deranged. There are many other hormones which can get deranged. So based on that treatment is given. See, usually most common, why I'm telling PCOS commonly is that's the most common thing what we see now. So in that way, those treatment will usually go for like not 5 days, 6 days. Those are like months wise treatment, because they will not only have that facial hair. Some people will have only facial hair, but most of them will have menstrual irregularities also, abnormal periods, delayed periods, bleeding is less. All these things also will be there. They'll be gaining weight. They'll be eating less, but they'll be gaining weight. Those are all small signs or symptoms of these changes which is happening. They can pick it up by themselves also. So these treatments doesn't last for 3 months, 6 months, 9 months. Some severe form will actually require 1 year also. But what I wanted to stress on here is not only these hormonal balances because of medicines and get through that, but mainly the patient's diet and exercise also plays an important role.
Will they get any permanent solution?
Yes, PCOS is something which is treatable.
Okay.
So that is something which is treatable. So there is a treating, with the medicines along with your lifestyle modification. Definitely for cosmetic concerns, they will, because if it's so much of a problematic, they will have to go for that treatment also. So, but yes, PCOS is curable. But only thing is we need to know that. I always give an example of diabetes. If you are diagnosed with diabetes, you will go to a doctor, take those tablets, and come home and eat your whatever sweets, jamun and paisam and all that. No, right?
Okay.
So same way PCOS is like that, where you need to concentrate on your diet also. I am taking all these treatments, it should come down. No, it's a systemic, whole body is getting affected.
Okay.
So all these things needs to be considered. Only then it can be controlled.
Okay.
There is a treatable, curable.
Faizan sir, any other procedure for this one?
No, as such, there 5 years, 10 years back, there were other procedures called as electrolysis and radiofrequency treatments. But all those are becoming obsolete in the current generation because there are more, better technology to target this. So, as said, the unwanted hair growth generally creates a social anxiety in patients. So, whenever it is in a thicker fashion, the unwanted hair growth, people tend to start shaving or trimming or waxing, lucking bleaching. So these
Okay.
are the type of methods, home remedies for unwanted hair growth. Many people tend to resort to this. So once they start
Excuse
doing
me, sir, for example, sir, this threading, bleaching, is it a temporary solution?
this is completely temporary, because whatever we are doing, we are not destroying the follicle.
Okay.
So whatever these methods, whatever I just mentioned, we are not destroying the follicles. We are just taking care of that particular hair shaft which is coming out. So that is the reason it is temporary. More than just being temporary, it is causing more damage also.
Okay.
How it is causing damage is, whenever you are considering even trimming or shaving or any other method for that matter, you are not just concerned, you are not just taking care of the hair, but you are even touching the skin aspect.
Okay.
So whenever you keep doing that, automatically the skin starts becoming rough. Automatically the skin starts becoming more vulnerable. So more amount of damage happens in the skin area, and it tends to stay permanently. And many of them also think that shaving causes increase in hair growth, so they tend to not shave, but rather go for something like bleaching or plucking. So the moment that is one of the wrong concepts. Actually, shaving does not increase hair growth. So if that was the case, all men will have thick bushy beard. So that is not the case like that. So unless and until there is a follicle, if there is no follicle, then there won't be any hair growth in that particular area.
Okay. See, sir, in future, any side effect after the procedure, any side effect you will get?
Not as side effect as such. There was nothing of that sort in laser hair reduction, as it is a very safe method. This particular laser is devised such a way that the particular wavelength of this laser light source will only target the hair follicle, and it will not even touch any other components of the skin. A trained professional, that is a dermatologist or a plastic surgeon or a cosmetic gynecologist, will have the knowledge to target that particular hair follicle. So each and every patient, whenever we are starting on with the procedure, we assess the patient first. We see what is the growth, we see the thickness of the hair, we see any other associated symptoms are there or not, and then decide upon the settings or whatever we are going to input into the laser machine. So once we do that, then it is the execution mode.
Okay. See, ma'am, this procedure has more sessions. Then what will be the cost?
Generally, the cost factor depends on the type of the machine, the type of hair growth, the clinical condition the patient is in, and the place. So all these things matter. So there is no fixed amount of fixed cost for each for laser reduction in each place. So it depends and varies with patient to patient as well. So generally, whenever a patient enters...
Excuse me, Faizan, why I am asking that, see, naturally common people approaching beauty parlor like that, see, they don't know what will be the latest side effect. That's why I am asking that.
What he mentioned rightly was that trained person has to do it, because the type of machine matters. There are different kind of this. There's no one machine called laser hair reduction machine. There are different standard, substandard, superior machines where different wavelength of lasers will be there. So that's when those settings and side effects will be less. So that's why he rightly mentioned that training is a little bit of that amount of knowledge you need to have. That's when your local person's having it might be a small IPL also does its job, but it has its own effects and side effects also, and probably that cost wise initially might be low, but they will need more number of sessions.
So understanding the cost overall is basically whenever a person starts to invest in laser hair reduction, they have to roughly invest something for about 8 to 10 sessions. And you have to understand that that is the investment for life. So when you consider a cumulative investment on razor, waxing, threading and all these procedures throughout the life, you are not ending it just because you are 20 years or 22 years. It is still your 60, 40, 50, 60 years as well. So when you consider the cumulative cost to manage that hair and the damage which is causing cost to the skin, and again the treatment for skin, so all those cumulative costs, when we compare, laser hair reduction cost is actually too less in comparison to that.
Sruthy ma'am, see, all these procedures will we get in Kanhangad?
Yes, definitely. At our center, we both are working in the same center, so there is a completion. We have a superior machine here, which are giving us very good results, and patients are coming here. So we should just be aware that
Okay.
you probably need a 2% to handle this at Kanhangad itself.
Okay. Today we are winding up our Meditrack program. In this program, our viewers had viewer has some important ideas about unwanted facial hair. If you required, here is prominent doctors are here. Dr. Sruthy ma'am, gynecologist, and Dr. Faizan Kalekhan, dermatologist. You can approach them. Thank you, ma'am. Okay, thank you, sir.